You send a message, it says, read. Still there is no reply. You invite them out, they cancel again. You offer advice, they become even quieter. And now you're wondering, should I keep reaching out? Should I give them space? What can I say? And how can I help without creating even more pressure? Here's something many caring people discover too late. Good intention can still feel overwhelming to someone with depression. And a motivational speech may sound like, you should be doing better. Advice may sound like, this should be easy to solve. And waiting for them to ask for help may leave them completely alone. So what actually helps? In this video, I will share 33 practical ways to support someone with depression. You will learn what to say, how to stay connected when they pull away, how to make everyday life easier, how to encourage professional support, and what to do when you become concerned about their safety. Throughout this video, remember the support compass. 3 directions. Connect before you correct, make the next step smaller, build a bridge toward appropriate help. You're there to reduce isolation. You're there to make support easier to reach, and sometimes your steady presence can make a greater difference than you realize. Let us begin. Part 1. Understand what you're seeking. Tip 1. Take depression seriously. Depression reaches far beyond sadness. It can affect energy, sleep, appetite, concentration, motivation, relationships, and hope. Someone may understand exactly what could help them. They may still feel unable to begin. Treat their struggle as real. Tip 2. Begin with observations. Perhaps the person has never received a diagnosis. Begin with what you've noticed. You could say, you seem exhausted lately. You've been spending much more time alone. Ordinary things seem especially difficult right now. And then add, I care about you. An observation opens the door. A label may create distance. Tip 3. Separate the person from the symptoms. Depression can make someone quiet, distant, irritable, or emotionally unavailable. This can feel deeply personal. Remind yourself, I'm seeing the effect of their struggle. The person I care about is still here. This perspective helps you respond with greater patience and calm. Tip 4. Adjust your expectations. During depression, ordinary tasks can require enormous effort. Taking a shower may be progress. Answering one message may be progress. Eating something may be progress. Attending an appointment may be a major achievement. Measure progress according to the person's current capacity. Small steps still count. Tip 5. Learn their individual pattern. Depression looks different from person to person. One person sleeps all day, another barely sleeps, and one person cries, another becomes irritable, someone else continues working and smiling while feeling empty inside. Ask yourself, what has changed? What seems especially difficult? When does a person have slightly more energy? Support becomes more effective when it fits the individual. Understanding matters. Connection comes next. And this is where many people accidentally disappear. Part 2. Keep the connection alive. Tip 6. Send messages that require no response. Because even replying to a message may feel like another demanding task. Test. Thinking of you. No response needed. Or, you matter to me. I will check in again tomorrow. This offers connection without creating another obligation, and this is important. Tip 7. Be consistent. One powerful conversation rarely changes everything. Steady contact often matters more. Send another message. Call again another day. Invite them again next week. Consistency communicates you still matter, even when you have very little energy to respond. Tip 8. Offer quiet company. Support does not always require conversation. You could watch a movie together, sit in the same room, take a short drive, or work quietly while they rest. Say, we can talk, watch something, or simply sit together. Sometimes presence feels safer than questions. Tip 9. Make invitations tiny. A full evening out may feel overwhelming, so try something smaller. Would you like to stand outside with me for 2 minutes? Or would you like to walk to the mailbox? Would you like to sit beside an open window? A tiny invitation creates an easier beginning. Small steps. Tip 10. Make declining easy. The person may already feel guilty about disappointing others. So say, I would enjoy seeing you. Today is okay. Another day is okay too. This protects the relationship from additional pressure. Tip 11. Keep including them. Continue inviting them after several refusals. Keep every invitation warm and easy to decline. Depression may tell them, everyone has given up on me. Your continued presence offers another message. You still belong. Connection opens the door. The next challenge is knowing what to say when the door opens. Part 3. Talk in a way that feels safe. Tip 12. Ask what kind of support would help. Ask what would feel most helpful today. And then offer a few choices. Listening. Practical help. Quiet company. Or space followed by another check-in later. These choices reduce mental effort. They also restore a sense of control. Tip 13. A simple question. How are you feeling? It can be surprisingly difficult to answer. Say, is today heavier than yesterday? Would company or quiet feel better? Have you eaten anything today? Would it help if I stayed for a while? Simple questions create an easier doorway. Tip 14. Listen to understand. Many people listen while preparing the next suggestion. What's way better is listening for meaning instead. What feels unbearable? What are you afraid of? What do they need you to understand? Your full attention may help more than an impressive answer. Tip 15. Reflect what you hear. You can say, that sounds exhausting. It sounds as though everything requires enormous effort. You've been carrying this for a long time. Reflection communicates, I hear you. I'm staying. Your experience matters. Tip 16. Validate the pain. Validation means meeting the person where they are. You might say, I understand that the future feels impossible right now. And then add, we can focus on getting through today. You're acknowledging the present experience while making the next step manageable. Tip 17. Offer a grounded hope. Bright slogans often feel far away from the person's reality. Offer honest hope instead. This is very hard. You deserve support. You can leave the bigger questions for another day. We can look for the next step together. Hope becomes believable when it stands beside reality. Tip 18. Ask before giving advice. This one question can transform a conversation. Would you like me to listen? Would some ideas feel helpful? When they choose ideas, offer one or two. A long list may feel like another mountain. Words can reduce emotional pressure. Practical help can reduce the weight of the day. Part 4. Make everyday life easier. Tip 19. Make specific offers. Let me know how I can help. That sounds caring. It also requires the person to identify a need, make a decision, and ask. Offer something concrete. I'm going to the grocery store. May I bring you 3 things? I can drive you to your appointment. I can sit beside you while you make that call. Specific offers are easier to accept. Tip 20. Reduce the number of decisions. Instead of asking, what would you like to eat? Say, what soup or what sandwich would you like? Instead of asking, what would you like to do? You could say, would you prefer a short walk or 10 minutes while I'm here and we're quiet? 2 clear options can reduce decision fatigue. Tip 21. Support basic needs. Food, water, clean clothing, and household tasks may become difficult. Bring a simple meal. Fill a water bottle. Help change the sheets. Take out the trash. Ask permission first. Support their dignity as well as their practical needs. Tip 22. Help them start. The first few seconds of a task may feel like the hardest part. So offer a shared beginning. We can wash 3 dishes together. I will sit beside you while you write the first sentence. Let us place your shoes beside the door. Make the starting point smaller. Tip 23. Invite gentle movement in daylight. Movement and daylight may support recovery. Present them as invitations. Say, Would you like to walk with me for 5 minutes, or would you like to sit outside for a moment? Companionship feels very different from a command. Tip 24. Create a gentle rhythm. Depression can make days blur together. A simple rhythm may offer orientation. A morning message, a regular meal, a short walk, a weekly appointment. A consistent bedtime routine keeps the structure realistic and flexible, because the goal is orientation. Perfection can wait. Tip 25. Notice effort. An action that looks tiny from the inside may require enormous courage. So say, I saw how hard it was to make that call. I'm glad you told me. Getting to that appointment took real effort. Specific recognition helps a person notice their remaining strength. Practical support can make today easier. Professional care can change the longer path. Part 5. Build a bridge toward professional help. Tip 26. Encourage professional care calmly. You might say, you have been carrying this for a while. I believe you deserve professional support. Treatment may include psychotherapy, medication, or a combination of approaches. A primary care provider can also assess whether medical conditions or medications may be contributing to the symptoms. Use warmth, use respect. Think partnership. Tip 27. Remove practical barriers. Finding help can involve searches, calls, forms, insurance questions, transportation, and waiting lists. Offer to make the process easier. Research suitable providers together. Write an email. Sit nearby during a phone call. Offer transportation. A smaller barrier can create access to meaningful help. Tip 28. Help them prepare for an appointment. Depression can affect concentration and memory. Help them write down when the symptoms began, changes in sleep or appetite, activities that have become difficult, medications and substances they use, and questions they want to ask. A short written page can make the appointment more useful. Tip 29. Support treatment safely. Ask, how can I support you with that? You might help them remember an appointment, provide transportation, or help them write down concerns to discuss with their clinician. Leave medication decisions to the person and their health care provider. Good support strengthens agency. Tip 30. Keep the door open when help is refused. That's important, because someone may feel ashamed, afraid, hopeless, overwhelmed, or simply exhausted. Pressure often creates more distance. So say, I respect that this is your decision. I'm still concerned about you. I will stay in contact. And I will help you take the first step when you're ready. You can also involve other trusted people. One person rarely needs to carry the entire situation. So, now we come to the most important part of this video. Part 6. Respond clearly when safety is at risk. Tip 31. Care about suicide. Pay attention when someone talks about wanting to die, feeling hopeless, feeling trapped, being a burden, having no reason to live, or looking for a way to end their life. Other warning signs may include giving away meaningful possessions, saying goodbye, withdrawing more intensely, increasing alcohol or drug use, or showing a sudden and concerning change of mood. When you are concerned, find out if you're thinking about suicide. Are you thinking about killing yourself? What kind of words are the best? It depends on the situation. It's important that you find out. And when you ask, pause. Listen to the answer. Stay present. Sometimes a direct question gives the person permission to tell the truth. Tip 32. Move from conversation to safety. When someone is in danger, remember the first 5 steps. Ask. Be there. Keep them safe. Help them connect. Follow up. Ask whether they have a plan. Ask whether they have access to what they would use. When immediate danger is present, stay with them when you can do so safely. Create distance from weapons, medications, or other lethal means when this can be done safely. Bring in professional support. Seek emergency help when the person has already harmed themselves or taken steps toward suicide. Keep their safety larger than a promise of secrecy. Involve trusted people and qualified professionals, and keep checking in after the immediate crisis. The crisis may pass. The need for connection often continues. Part 7. Make your support sustainable. Tip 33. Protect your own stability and boundaries. Supporting someone with depression can bring fear, sadness, frustration, exhaustion, and guilt. Your well-being matters too. It's important. So maintain your sleep, stay connected with people who support you, continue activities that restore you, and set clear, caring boundaries. You might say, I care about you deeply. I can stay for 30 minutes tonight, and I will call you again tomorrow. Depression can explain behavior. Your safety and dignity still matter. You can care deeply while allowing professionals and other trusted people to share the responsibility. Sustainable support is steady, clear, and human. 5 sentences you can use today. When you feel unsure, begin here. Thinking of you. No response needed. What would feel most helpful today? Would you like me to listen, or would ideas feel so helpful? You deserve support. We can find the next step together. And when you are concerned about their safety, are you thinking about suicide? Simple, clear, human. You never know which small act mattered most. The message that required No response. The meal left at the door. The quiet hour together. The ride to an appointment. The invitation that remained open. Or the direct question asked at exactly the right moment. Perfect words matter far less than steady presence. You can reduce isolation. You can make the next step easier. You can help create access to safety and professional support. Remember the support compass. Connect it before you correct. Make the next step smaller. Build a bridge toward help. You let your actions communicate. You matter, I'm still here. And we will find the next step together. When someone you care about is struggling, share this video with another person in the support circle. And subscribe for practical, compassionate ways to understand anxiety, depression, trauma, and the nervous system.